Today we will be discussing treatment options for my patient. My patient is a 40-year-old male with a diagnosis of an L5-S1 herniated disc. We know that this is the prolapse of a nucleus pulposa of a ruptured intervertebral disc into the spinal canal. Often this results in pressure on a spinal nerve, causing lower back pain. This pain may also radiate down into the leg, which my patient does present with. His past medical history include bilateral medial meniscectomies 5 and 10 years ago. So being aware of this just through your exercise not causing any increased pains or any symptoms that he may have within his knees are important. Now we will talk about subjective and objective data from the patient that rationalize my treatment options. His initial eval data include subjectively complaining of right lumbar ache and intermittent shooting pain into the right posterior thigh, and objectively active range of motion standing flexion at 25% with increased symptoms. His re-eval data includes, he states that his pain is better and he has symptoms less often, and they are now primarily in the right lumbar region and not in the right lower extremity. Objectively, his standing trunk active range of motion flexion has improved to 50%, and now he only presents with pain in the lumbar region and not in the right lower extremity. And now we will discuss the soft tissue mobilization chosen for my patient. The technique used is longitudinal to the paraspinals. The rationale for this is the patient has pain, stiffness, restrictions, and radicular symptoms. By performing soft tissue mobilization to the paraspinals, we're checking for and relieving any restrictions he may have. Subjective and objective findings that rationalize this, he complains of pain in the lower back and shows restrictions with standing. His trunk active range of motion flexion is 25% with increased pain in the lower back and right posterior leg. Now we'll move to the demonstration. I'll use deep prep. And I'll be sure to, before I start, to kind of warm up my hands and the tissues. And we're just going to run along the lengths of the muscle. We're just going to be going up the back. And with this technique, we'll be going on the right side of the spine and on the left. And that was a demonstration of soft tissue mobilization to the paraspinals. Now we will discuss the patient education chosen for my patient. I chose teaching the patient about body mechanics with lifting. This is important because this is how the patient injured himself to begin with. His job calls for lifting, therefore it is imperative the patient is able to do so safely. Things to remember when you're lifting, body mechanics with lifting: abdominal bracing, posterior pelvic tilt before lifting, keeping the load close to your body, pushing up through the legs and not your back, kneeling to the floor, do not simply bend at the hips, and using a back brace if needed. Okay, so with lifting at work, it's important to utilize an abdominal brace. So that means you're going to pull your belly button back like towards your spine. So you're not sucking it in, you're just pulling back like you're tightening your stomach muscles up. Also, what we're going to work with is a posterior pelvic tilt, which that means you're going to be pushing your hips forward. So not like you're bending at your knees, pushing forward, you're just going to do a slight tilt forward. Also, we're going to be bending down to the ground. You're not going to be bending over at the hips like so. When you get kneeled down, we're going to push up through your legs. So you're pushing up instead of pulling up through your back. Also, when you get down and you come up, we're going to keep the box close to your body. You don't want to have your arms straight out in front of you when you put it down and come up, okay? So we're going to abdominal brace, hips forward, bending down, pushing up through your legs, keeping it close to you, then putting it on the table, okay? Okay, so abdominal brace, hips forward, good. Kneeling down to the box, keep it close to your body, push up through your legs, and place it on the table. Good job. Now we're going to discuss the home exercise program. The exercise chosen is sitting rhomboid rows. The rationale for this is it helps to improve posture with sitting to decrease symptoms the patient is having with prolonged sitting. Subjectively, the patient complains of symptoms with sitting less than 5 minutes in the initial eval and greater than 30 minutes in the re-eval. Parameters and precautions to be aware of. We're going to perform 3 sets of 10 reps 2 times a day, trying to hold at 5 seconds at the end of each rep. Remember to breathe. Continuing to breathe throughout the exercise is important, and you don't want to hold your breath. The patient should not have increased pain or shooting pains. If these problems should begin, he should stop the exercise and report them to the PT or PTA. So we're going to have the patient bend his arms at 90 by his side. We're going to be pulling back, trying to squeeze your shoulder blades together. Hold that about 5 seconds. 2, 3, 4, 5. Good. And 4. Do you feel that squeeze in the back of your shoulder blades? All right, we're going to do it again. Pull back. 1, 2, 3, 4, 5, and forward. And back. 1, 2, 3, 4, 5, forward. Last time. Pull back. 1, 2, 3, 4, 5. Good. And relax. We're going to do these 3 sets of 10 reps 2 times a day. Try and hold 5 seconds at the end of that pull. We can modify this to make this harder by adding a TheraBand with resistance that he has to pull against, but for now we're going to stay with just actively doing it without any resistance. The prognosis for this patient is good. From the initial eval to the re-eval, he's already showing improvements and actively moving towards meeting all of his short-term and long-term goals. The patient should be able to return to the previous level of performance, permitting no further injuries. Modifications the patient will need to continue with are proper body mechanics with lifting to ensure safety. His estimated time for return. He's already back at work lifting 20 pounds, but he should be able to lift 50 pounds within the next 4 to 6 weeks. Thank you for your time, and this has been the treatment option for my patient.